because with the complaint of the nasal deformity, the hypernasality, and can you open your mouth, and nasal regurgitation of fluid. So is an operated case of left-sided cleft lip. There is a scar, just you can see here, and can you open your mouth? And you can see the scar in the palate as well. If you look in the anterior palate, there is a small fistula is present, and in this region, that's called prealveolar fistula. And he has an hypernasality. Can you tell your name, please? So you can see that he has a severe hypernasality. And when it comes to the nose, the tip deviation, there is very poor tip definition, alar flaring, tip is very bulbous and broad radix. So we are doing the multiple procedures for him. The first one will be a lip fistula closure. Can you open? So we'll close the fistula, which is the anterior palate as well as the prealveolar fistula, and doing minimal correction with the lip and the rhinoplasty. We'll be harvesting the rib and going to give him a good definition. So it's going to be it is called the secondary cleft deformity correction surgery. We'll be doing 3 procedures: fistula closure, rhinoplasty, and minimal lip revision.
Okay, that with gloves now very well. अभी कितना दिन हो गया? 12 days हुआ है क्या? ठीक है, चलो. We'll show you. काटे कुड़े, stitches अलाए कुड़े, मारा कुड़े कुड़े.